pro sports leagues are scrambling after a surge of coronavirus cases has forced some teams to reevaluate safety protocols and even postpone games. At least 90 NFL players have tested positive for COVID this week so far, including the Cleveland Browns quarterback, and they have a game on Saturday against the Las Vegas Raiders. And for the first time this NBA season, an outbreak among 10 ballers who played with the Chicago Bulls forced the league to postpone games. According to ESPN, 36 out of the league's 51 positive COVID cases in 2021 emerged in the past 2 weeks. The NHL hockey has also had to postpone several games this season, and more than 24 players have contracted COVID since Monday. The spike in cases has also put the NHL's participation in the Winter Olympics in doubt. And this has made for a throwback Thursday that nobody wants. It was nearly 2 years ago that millions of Americans felt the gravity of the pandemic sink in when major sport events began getting canceled, from March Madness to the remainder of baseball's spring training. With COVID cases up 40% from last month, according to data from Johns Hopkins University, many are wondering, is this 2020 all over again? Well, joining me now to discuss this is Dr. Kevin Sneed, Senior Associate Vice President at the University of South Florida Health and Dean at USF's Taneja College of Pharmacy. Good to see you as always, Dr. Sneed. Nice to have you here in the evening. All right, the Philadelphia Flyers are facing off with the Montreal Canadiens in an empty hockey stadium right now as we speak. Are we headed to the same place we were back in 2020?
Laverne, thank you very much for having me. There's a great possibility that we may be headed back in that direction. I think the big difference now is that we've had a full year of COVID fatigue. We've had much more controversy, much more mask controversy, vaccine controversy. And so a year later, even though we are faced with, number one, a very deadly and dangerous version in Delta and the emergence of Omicron, I think, this time around it's going to be a little bit different in terms of how we approach, how we do everything in public, whether it be concerts or professional college sports or anything along those lines. So it feels like deja vu, and unfortunately, it's not a good one.
Yeah, I mean, for a team to be playing in an empty stadium or an empty arena is unbelievable. Of course, in Canada, they have stricter regulations as well than we've had in the United States. But, with this latest surge of COVID and among pro sports leagues and throughout the country, what are you seeing in terms of how serious it is, despite the fact that we have these vaccines? What is that telling you about how effective they are? Because you've been involved in a lot of these studies and trials, if you want to share some of that with us.
Yeah, absolutely. One thing that we currently know, number one, even people who have either been infected or people who had vaccination early on, over time, there can be a waning of the effectiveness of that vaccine. Number two, when you really get down to it, nothing is going to be 100%. The biggest challenge that we're having right now, especially in what we're witnessing with Omicron, is the fact that even people who were vaccinated, who have been previously infected, you can be reinfected, because right now Omicron is really proving that it will reinfect people who were previously infected. We found that from South Africa, or people who were previously vaccinated. And right now we can't really compare all of the data that we gathered from South Africa all the way to what we're doing here in the United States, because they had a much different pattern of previous infection in South Africa than what we have here. The biggest challenge that we're going to have in our country is not really escape all the way from vaccination, but we still have 40% of our population that has not been vaccinated yet. And so the unvaccinated are really going to take the brunt of what happens with the co-infection or the dueling infections between Delta and Omicron. But those who primarily were vaccinated, they probably will get infected, but they probably also will have a much milder case of the overall COVID-19.
Well, nobody wants to get sick, even if it's just, a mild case. But I'm wondering, should sports fans, should they stay home, or is there any way they can go to these games and be safe?
That's a pretty good question overall. I mean, number one, if we had everybody go out in public and wear a mask, or if we were allowed to even have a mask mandate, we could feel much more confident about the people that we're around. As I mentioned before, now that we have such a controversy around wearing masks out in public, bringing people indoors during the cold, during the wintertime, we don't really understand what's going to happen right now in terms of what Omicron could mean. Right now, it happens to be 3% of all the cases that we've detected, but more than likely by the end of the month, that will be up to about 30% because it's doubling every 2 days in terms of the amount of people that's infecting. And so, for sports fans, and I happen to be a big sports fan, I can't wait to go to some of our basketball games here at our university. I think we need to make sure that we're doing everything we can to protect ourselves. And number one, we need to have everyone wear a mask and mitigate the opportunity for the virus to be spread to your neighbor, to your left or your right, or even around you.
So, Dr. Sneed, would you go into an arena right now full of fans and watch a game?
Well, I'm a little bit different, Laverne. We have to keep in mind, I'm seeing patients during the week. I'm going to exercise a lot more caution. I think it's really dangerous overall
Sure.
to
I
presume
understand that.
that I think it's dangerous to presume that anybody walking in is not going to be infected, even if you've been fully vaccinated. Currently, definition meaning two shot vaccines, that you cannot spread it to somebody else. And so, I'm kind of caught between a rock and a hard place. I want people to be able to enjoy themselves. We want to have confidence, but right now, and let me make a quick statement about even all
got
of
to be careful.
yeah, the
You
athletes
got
who
to
have
be
been
careful.
affected in all of our pro sports right now, many of them right now, we have to keep in mind, COVID can damage your heart, it can damage your lungs, it can damage your intestines, it can damage your kidneys. There are a lot of challenges that we have to worry about beyond just worrying whether or not people live or die. And so I think the NFL, the NBA, and everybody else, I think they're doing the right thing by pulling the players out, making sure they're going to be okay, doing the proper testing, doing the proper cardiovascular testing before they go back, because we don't want people to have a long-term effect because we took Omicron or any other version or Delta or anything, too lightly, even though they're the most conditioned athletes on the planet.
Real quick though, Dr. Sneed, do you think the leagues would shut down for long enough at this point? I mean, is it realistic to expect players to go back into bubbles? I mean, is it long term enough for it to be effective?
At this current moment, I think we're going to have to wait and see. We've learned a lot over the past year. We've learned that many people can come back. I think last year, the NBA bubble was one of the most successful things we've ever witnessed in the midst of the pandemic at that time. But as I mentioned before, we have a lot of COVID fatigue. And so I'm not sure that there will be a tolerance on the part of the owners, the players, the fans, the communities to really tolerate a large shutdown away from sports or anything else right now, which is a shame because, again, right now, long COVID for many people will be hanging right around the corner.
Yeah, we got to remember that there's also sometimes long-term effects. But Dr. Sneed, thank you so much for joining us this evening. I appreciate it, and thanks for all you do as a healthcare provider.